that's going to ask you some demographic information. QPR is a grant-funded program through the region here, and so we just like to keep track of everyone that is trained, but it's only whatever you're comfortable disclosing. So if you do not wish to be contacted by them for a survey, please don't feel like you have to fill that out. We just like to know what kind of folks are getting the training, what their employment is, what part of the state they're in, things like that. So that's why you have this in front of you. Then you should have a copy of my PowerPoint. So everything that you see up here today is right here in front of you too, so that you can take some notes if you want, or also just so you have the information to take with you. This next sheet, it's a front and back. Usually due to time constraints, we don't have an extra half hour to go over this, so I want you to have the information. This is specifically how to incorporate QPR in the workplace. We're going to talk about it a little bit in the presentation, but this just elaborates on it. So I would encourage you all to take it with you and read through it. So in dealing with, when an employee maybe comes to you with some concerning statements, or a coworker, this is a little guide to help you with that. And then lastly, we have these little half sheets, optional. I just appreciate any feedback that you might have, the good, the bad, the ugly. Anything you want to throw at me, I really do appreciate any kind of feedback. So I know that's a lot to ask for you to fill out. Again, just fill out whatever you're comfortable with. Okay, let me back up a little bit. My name is Olivia Moser. I'm with Continuum EAP, your EAP program that is a benefit to you through your employer. We have lots of different services that we offer. I did notice that some of you picked up the brochure. There's some more in the back if you didn't get one. I'm not going to spend a ton of time talking about us. Shameless plug for our program. We are available to you. If you ever have any questions of how we can serve you, if it's not something on that sheet, don't hesitate to call us. But our services are confidential and free to you and your family members, whether that's counseling or some consultations, trainings, things like that. So don't hesitate to use us. Alrighty. We are about to talk about a pretty heavy topic that folks usually don't like to talk about. Yes, we hear things in the media. Yes, we might have been touched by it personally in our lives, but it's not exactly talked about like the NFL player who's not standing for the national anthem, or what Trump or Hillary is doing today, which is unfortunate. It's not talked about very often. But I wanted to let you know that personally as a trainer, I try to keep things pretty positive, pretty interactive. And so if I say a joke, or I use sarcasm, or I do something with a smile, it's not to make light of this topic. I want you to know that. This is a very serious topic. But I also want you to feel comfortable talking about it. I want to hear from you. I want people to not turn a blind eye to this. So that I just wanted to give you that little intro into this topic. And just to kind of get us started before we get into the lovely PowerPoint presentation, I thought I'd go over some questions. And I do have prizes for people who want to give me answers. When you think of suicide, what's the first thing that comes to your mind as far as what population is most at risk?
Young.
Young? What can you elaborate on that? What do you mean by young?
12 to 15.
12 to 15, okay. That's the number one killer for that age group is suicide. What other age group, though, might be at higher risk when we talk about number of folks who commit?
Age.
College age.
College age?
Mid-age. Like people going through divorce, having money trouble.
Okay.
I feel like older Americans, like retired in 60s, 70s, 80s.
Yep. Elderly white men is where we see the most. Yep.
Is that because of the veterans?
Sure, that's part of it. We have retirement, yep, lots of different life stressors. So here in the United States, I think right now the current is about 60 to 70% of our elderly men are veterans. So that right there tells you that they've got a couple of risk factors going on, not just their age, but that they're also vet status. But what we also know is that only about 22% of them receive any kind of help for any mental health struggles, which is a very low number, unfortunately. I didn't hand out treats to everyone that participated, but I'll get to everybody, I will. I appreciate you throwing things out. So here in Nebraska, we do see trends. We see ebbs and flows of those different ages that you all identified. So some years we'll see a peak in our young population, and then others we will see more of the elderly men. But I would just want to remind you of one thing, and that is that we do have more suicides than homicides, way more. But which ones do you hear about? Absolutely, but way more, we have way more. So just to be thinking about that, you know, they don't really post that in an article always. They don't always rule it as a suicide. Sometimes it's accidental this or overdose on drugs. It's not always classified as that, so unfortunately then sometimes our statistics are skewed. So why am I telling you this? Just to create awareness that, not that you're going to be skeptical about every single death that you hear about if it's an accident of some sort, but just to be aware of who, you know, your loved ones, your friends, your coworkers, what's going on with them, if there's some of these red flags we're going to talk about, because obviously people are at risk, we know that. So it's okay to talk about it. Let's see here, throw out some other things. True or false? Women commit suicide more often than men.
False.
Okay. Yes. So, men commit more often. However, women attempt 4 times more often than men. Why would you think that would be, or what kind of thoughts?
Pills, or they probably use a gun.
Absolutely, more lethal force. So they do it on the first try, if you will, for lack of a better term. Absolutely. However, in China, women complete suicide more often than men. So they just have a different demographic set, lots of different set of stressors there, but just to give you a comparison. Last thing before we get started, why would you say we see more suicides in states like Wyoming, Montana, let's see, where's some, Alaska? More isolated, absolutely. So they don't have the access to the mental health services like some of the other states do. So the more remote folks are, they don't know what's available to them service-wise, how to get help. Another just little thing to, that's something that we're seeing as a trend is Native American adolescent boys, suicide rates are on the rise nationally. So we're fortunate enough that research studies are being done very frequently on suicide rates, and so we can see those trends, and for some reason that is on a trend right now. I don't really know all the information as to why, but it's just good to know what's going on and who we need to reach out to. Okay. I am going to send you home with some stuff today, with all of the QPR information. So whether it's to be, you know, keep it in your desk or take it home and share with your family members, they are very good about sending us with information. So I don't want you to feel like you've got to memorize everything we go over today. And also, if you find that you want to talk a situation through, don't hesitate to call us. We obviously can do that. So QPR, I'm going to jump into the presentation here, stands for Question, Persuade, Refer. It simplifies the process of having a pretty heavy conversation with someone. So we're going to talk about how to ask the question of someone, are you feeling suicidal? How to persuade them to get help. Hey, can I get you to a counselor? Can I take you somewhere? How to refer them. Hey, can I drive you? Can I make that appointment for you? What does that look like? So we're going to go through all 3 of those today. I'm going to share a video with you real quick. This video was put out, it's been a few years ago, I believe. And it shows a gentleman having an intervention right out in the middle of the street with someone who was suicidal. And I just think it's a very powerful video, so we're going to show that real quick. It's only about a minute long. And Carly, hopefully I don't screw this up.
Are you okay?
Will everybody be able to hear that? guy is driving a bus down the street. That's his job. And as you can see, there's a bunch of cars passing by, just kind of everyday life is occurring. And I'll turn this up as much as I can.
Ma'am, are you okay?
It didn't seem real because of what was going on around. You know, traffic was going as normal, you know, pedestrians going by as normal.
Ma'am, are you okay?
She was distraught. She was distant. She was really disconnected. I grabbed her and I grabbed her arm and I put my arm around her and I said, do you want to come on this side of the guardrail? And that was actually the first time she actually spoke to me. She said, yes, it was meant to be. I was supposed to be there for her at that moment, and I was. I wanted to convey that, you know, whatever it was, we're going to help you through whatever it is, and it's not as serious as jumping onto the 198. I feel like I did what I was supposed to do at the time. I'm a football guy, so, you know, you sit on the bench and the coach calls your number, and you got to go in there and make a play, and you got to do what the play calls for, and I think that's what I did.
Okay. What did you see him do?
Well, he took the time. He took the time to stop.
Absolutely. He could have just gone about his day, right? Kept driving. He's got a route to do. He's got people on the bus to take to where they need to be. He happens to look over and see that. How often do you really stop and look at who's walking on the sidewalk? I know I don't. And he sees, oh my gosh, she's on the other side, which again, you'd have to really kind of stop and pause to notice that. And he did a couple of really nice things too. He got physically close to her. And once he got over on the rail, out from the rail, he had her sit down. Is he a counselor or a psychiatrist? No. This man is everyday person like us. So why I like to show this video, it can be any one of us that helps another person out. It doesn't have to be a trained professional counselor or psychiatrist, somebody that works at a hospital. We can all do this. It might not be the most comfortable thing to do. You might rather not do it, but I like how he shows how simple it can be. Now, do all of them end like this? Sure, probably not. There's going to be some more, or maybe you have to talk to him a little bit longer, do some more persuading, but it can be that simple. And then he got her to where she needed to go and got some help. Any other thoughts from watching that little clip? So just a couple of things. QPR is not intended to be a form of treatment. It's not your job to take on the counselor role. It's not your job to diagnose what's going on with them. However, it is intended to offer hope through being that positive action person. You might be the only person that has stopped and said, how are you doing? You look like you're, I'm concerned. You look different today, or what's going on? You might be the first person to do that for someone. You might think, oh, they've got tons of friends, or they're surrounded by loved ones all the time. You might be the very first one that intervenes with them, so keep that in mind. I know this is really hard to see up here, and I apologize for that. This is just a piece of statistics, again, to show the age groups that are affected. Obviously, when we have older folks, there's other kinds of medical things that start to rank higher. But as you'll see, a gentleman pointed out earlier, age 10 to 14, the #1 killer is suicide. Now, I don't know about you, but when I think of a 10-year-old, I don't even know if I knew what suicide was when I was 10, let alone how to do it or how to find the means. So that's just very, very impactful to me. These are, this is a nationwide study that was done. This is not just here in Nebraska. We will go through the Nebraska stats next. This is just Lancaster County. And I'm sorry, it feels too weird for me to be up there on that platform. I like to be out here. So just to give some numbers through 2005 to 2014, the number of suicides that we had rural Lancaster County, so not in Lincoln proper. What does that mean for us? This is more to show you the numbers. So we have spikes, as you can see. So some things to keep in mind. It might make sense to us when we are pretty deep in a recession, when there's lots of negativity going on in our society. It makes sense when we see some trends like this. But then we have years where it doesn't make sense at all, and you wonder, like, what's going on? What are some of the additional stressors for folks? But that's another thing to keep in mind. We all have our own set of stressors. It doesn't always depend on what's going on in our society. So just because we think, oh yeah, everybody's having a rough time right now. Well, not necessarily. Everybody experiences things very differently. So just keep that in mind. This again just points out the ages breakdown for our youth. QPR, the reason we're able to do things like QPR is a grant through the region who works with our youth here in Lancaster County and also surrounding counties in southeast Nebraska. I'm not going to go through these, but you do have these in front of you for your own reference for numbers. Okay, so when we talk about suicide or when we think about suicide, there's often some myths that we have in our mind. Maybe not. Maybe you're very well versed on what's truth, what's a myth about suicide, but I think it's important to go through some of the major ones. So no one can stop a suicide, it's inevitable. He or she was going to do it no matter what I said to him. Ever thought that? I know I used to. When I was learning about mental health, it was like, oh, we tried, but there was nothing else we could do. They were going to do it. Well, plenty of research shows us that about 90% of folks given an intervention go on to not complete suicide. That's a huge number. So, again, keep that in mind. We often like to tell ourselves certain things to make sense of it or not to feel guilt about it. And now if one is completed, does that mean that people didn't help? No. Probably lots of folks helped intervene. Every situation is different. So by no means am I trying to say you should feel guilty if one happens. But we just know that given even the simple intervention, like asking how are you doing or what's going on, can help prevent a suicide. Another myth, confronting a person about suicide will only make them angry and increase the risk. So the idea that you're placing the thought in their mind. I've definitely thought that myself. I used to work in corrections and I thought, oh, I don't want to go ask him about it. Then he's going to think that that's what he should do. Again, huge myth. You are opening the door for them. Like, oh, this person understands, they get it. Yeah, I am feeling that low. I am having those kinds of thoughts. We already talked about the next one, only experts can prevent suicide. Obviously, the bus driver in the video is a perfect example that it doesn't matter what you do for a living, it doesn't matter what your background is. We're all capable of that. I always tell folks about my QPR training. I was in a group with 30 individuals and I was the only mental health therapist. So I thought that was pretty cool. I sat next to a gentleman that was a financial advisor and we joked that I had absolutely no idea what he did and he joked that he didn't want to ever know what I did. So it really can be anyone. Another myth, suicidal people keep their plans to themselves. If they're really going to do it, they're not going to tell anybody. That's a myth. Most of them will communicate that if given the opportunity. Those who talk about suicide don't do it, so they're just putting it out there like a plea for attention. Well, we know that there is lots of that does happen, and those folks do eventually then have attempts, maybe even several attempts. We need to take every single one of those comments seriously. So maybe this is the 10th time you're hearing about it from someone. That might be the time that they're seriously considering it. So as much as you might want to say, oh, here we go again, or I don't know what I'm going to do this time to help, do what you can. Talk to them, open that door. And then once a person decides to complete it, there's nothing anyone can do to stop them. We just talked about that. It is preventable. There are going to be times, though, when someone You think you have done everything possible for them, and they still complete it for one reason or another. We don't know what's going through their mind. So what I like to share with folks is, we don't need to include judgments there. We don't know what kind of a dark place they were truly in, and we'll never know, unfortunately. So we have to push aside those judgments and accept that I tried, I did everything that I possibly could to help that person.
Can you explain the suicides, like the student that is very involved in school, high school, very good with his grades, and then comes downtown to a band concert, and after the concert jumps off one of the parking lot. How would, people were like so surprised. He didn't, if you saw his picture in the annual, he looked happy. Is it chemical, or is it just, he was so, what goes through their mind? Because my kids were like, why would he do that? And they were so upset.
Well, he's not alone. We've had several of those recently. We've had several of those historically, nationwide, we do too. So before I answer, I'm going to open it up to the group. I'm sure you've seen things in the newspaper like that, or talked to folks. Maybe you've personally experienced a loved one that this is similar demographics. What are some things that come to your mind that might be possible that were going on for him? Trauma that no one knew about, right? The invisible things that you don't know. Could have happened a long time ago and he never had the opportunity to talk about it. Sure. It's a big one. Pressure. You have to get good grades. You have to be involved in all of this. Absolutely. That is a huge piece when we talk about our younger folks, the college age especially. Huge transition in life. So many different pressures they're not used to. And if they don't have a certain effective coping skills to deal with that, absolutely. Suicide sometimes becomes an option. You mentioned chemical.
I just wonder if there's something,
When we talk about depression, that's a different chemical makeup in the brain. So there's that side of it, but then also our brains are not fully developed until about age 24. So we're also not thinking, they're not processing like a 40-year-old adult would. So that's something else to keep in mind. The problem-solving skills are not developed like your problem-solving skills might be. So that's another piece of it. So I'm glad you mentioned the ones that you did, because a lot of them are those hidden ones that you don't see. You see a smile in a picture. You see a star athlete. Oh, their life must be great. We have truly no idea what goes on in a person's life, what's happened to them. And unfortunately, when traumatic things happen, a lot of folks don't want to talk about it or deal with it. And so they keep that stuff down, and then we see maladaptive coping skills, and sometimes that means suicide.
but it seems like the kids nowadays are so, I have to be perfect, I have to be elected this, I have to do that. And they just have more so than when I was that age. And it's so sad because I tell, my kids, you can fail and you're fine, you're gonna be okay. But others, they just really, it's like they have to be something. Is that what you're seeing? I mean, is there a trend in
there is that.
in the schools?
What I will tell you though, is that when we talk about statistics in that age group, that's been for quite a while. So usually I will have folks say, oh, it's because of Facebook or the increase in the internet usage and cyberbullying. Yes, there is that, and we hear about that now, but that age group was still at risk 15 and 20 years ago. So we just have to put that into perspective, that there's all kinds of factors going on there. So when you think about that and the pressures that they're experiencing, think about that for all the age groups. Think about the pressure on someone who's retiring that maybe doesn't have the retirement plan they'd hoped for, or the person who just found out they have a terminal disease. So lots of different things going on for all of the different age groups. Thank you for bringing that up. We're going to talk next about what are some of those red flag behaviors that maybe you should be looking for. By no means does this mean that we're all gonna become experts on this in this room, but it's good to know what are some of the ones that I should maybe think twice about. So there's some obvious ones, direct verbal cues. So someone outright says this. And these are all quotes that someone has said who has then gone on to complete a suicide. I've decided to kill myself. Pretty direct. I wish I were dead. I'm going to commit suicide. I'm going to end it all. Or if something doesn't happen, I'll kill myself. So some of those circumstantial ones. If I don't make all A's this semester, that's it, I'm done. If my boyfriend or girlfriend breaks up with me, I'm gonna do this. We see that a lot too. So, the direct verbal cues, if someone says one of those to you, it might be a shocker. You might think, well, what the heck am I supposed to do with that now? But those are, direct, okay, let's sit down, tell me more about what's going on, how you doing? Or, would you walk with me to so-and-so's office? And we'll get into more of those steps. So some of the more indirect. I'm tired of life, I just can't go on. My family would be better off without me. Who cares if I'm dead anyway? Some of those that they're not really saying specifically that they want to commit suicide or complete suicide. But are they concerning statements? Absolutely. I usually get questioned on, well, like, what if it's the coworker who always hates going to the meetings, and so they make some offhanded comment like, oh, I'd rather be dead than walk into this meeting. You make that decision. Like I said earlier, they might make that comment 10 times and on the 10th time decide like they really mean it. So, you might feel like you're having to go out of your way, but would it cost you anything to just be like, hey, you doing all right today? Open that door for them, and if they're like, oh yeah, it's just these meetings. Okay, well at least you asked. One of the bottom ones here, pretty soon you won't have to worry about me. Pretty strong hint that something's going to happen. We hear these phrases more often with our elderly folks. I know I'm going to be a financial burden to you, or I know that you're going to have to come and take care of me, but don't worry, soon enough I won't be a burden to you. So some of the behavioral clues, so some of the actions that you see people engaging in. A previous suicide attempt. All of my classes I've ever taken, all of my experience in working with folks that have had suicidal ideation, that's the first thing we're taught to ask. Have you ever attempted before? It's like the #1 sign that they're primed to attempt again. So if you happen to know that about someone, or maybe they share that with you, that should be another clue for you that, okay, I maybe need to ask a few further questions, or I really do need to kind of get them to the next person to help. Some of these other ones are things we've just seen from folks that who do go on to complete suicide. So acquiring a gun or stocking up pills, co-occurring depression, moodiness, or hopelessness. We're going to talk about that a little bit later in the statistics of how many folks who complete a suicide have a mental health diagnosis. Putting their personal affairs in order. What does that look like? What kind of behaviors would you see that would go under that category? Giving things away. Coming to Union Bank, saying I need to talk to somebody about this or that. How can I give my kids my money? What else might you see with that? Changing your will. All of a sudden you want to switch it over to different people or change some things? Absolutely. Now, are we going to see these always? No. These are, again, just some lists of possible things you might see or hear from someone. Giving away things, mentioned that, that's a big one. Sudden interest or disinterest in religion. This one is kind of hard to describe, but basically what it comes down to is this person has never once gone to church before that you're aware of, and then all of a sudden they're going 2 or 3 times a week. Hey, what's going on? That's not a bad thing. Maybe they just decided they wanted to get more involved. Not a bad thing, but you might want to ask them, like, oh, hey, I noticed that you joined this church. What kind of interest do you have? And just ask them. Or maybe they were going to church every Sunday, every Wednesday, or whatever that looked like, and then all of a sudden they just completely dropped off. What we know about folks who are struggling with some suicidal ideation is that they need to make it right in their head, spiritually, whatever their beliefs are. And so we might see that they need to get right, or they need to shy away because they feel that it's against their religious beliefs. Drug or alcohol abuse or relapse after a period of recovery. Again, very high statistics that show that suicides occur when people are under the influence of drugs or alcohol. So we've seen some, I know in the newspaper here in the last 6 months or so, we've seen some suicides that occurred out of someone taking a drug that they didn't know what it was, and it literally just sent them into a whirlwind, and they ended up completing suicide as part of that. Now, was there really anything else going on with them? You know, we would have to look into that person's history, but we do see that fairly often. Especially with the relapse, they've been doing really well in their sobriety, and they relapsed. So much shame and guilt goes along with that, so they might feel that suicide is the only way to end that. Unexplained anger, aggression, or irritability. This one is a pretty vague one, I understand that. We all are gonna have our days, right? We're all gonna come to work, I'm frustrated with what my kids are doing, or, oh, we have such a big project going on, and you might see they're more irritable than usual. Are you gonna question them every time that happens about whether or not they're suicidal? Probably not. But what I'm talking about is like really out of the ordinary, like somebody who is very, very friendly, open person, and all of a sudden they are very closed off, snap at you, things like that. You start to see a pattern of those behaviors. Some situational clues. So we kind of touched on this a little bit earlier, but some of these situations will warrant big red flags for someone to complete a suicide. So being fired or being expelled from school. Think about a college student who just moved 2,000 miles away from their family and friends and is taking a full load of classes and finds out they're kicked out. You know, just put yourself in that mindset. They're 18, 19 years old. My life has just ended, basically, because they're not able to see beyond that. Or somebody who's towards the end of their career and you just have a big merger and they decided not to retain you. Well, there goes so many of your life plans, whether it was to retire and travel or who knows what. So again, basically any situations where your life changes overnight. Loss of relationship, death of a loved one, diagnosis of a serious terminal illness. We see this a lot with our elderly folks. They find out that they only have maybe 6 months to a year to live, so why put my family through that stress of treatment? I'm just going to end my life. Or they think that that's the better option rather than going through treatment. Unexpected loss of freedom or fear of punishment. So we see folks who are maybe facing long-term jail sentences or prison sentences because they don't know what that's going to be like. All of a sudden their life is changed, their freedom is taken away. Anticipated loss of financial security. We don't hear about these often, but we have had some cases in Nebraska where I can think of one gentleman that comes to mind that I had some contact with a long, long time ago, who tried to stage a death basically, but was ultimately committing suicide so that his family could take out his life insurance policy because they had come into such financial disruption. Now, are you as coworkers, as friends, as family, going to always see these things or hear about these things? No, not always. But if they start talking about, yeah, I've been thinking about that, I've been looking into my life insurance policy, what's yours like? And you don't know why they would just randomly ask out of the blue, that might be something to follow up with. Loss of a cherished therapist, counselor, or teacher. This is, if you've been working with someone for a really long time and that changes, we do see that. More so in individuals who are struggling with a very severe, persistent mental illness. Maybe they've been working with the same counselor for 5 years. That's a huge change for them. or fear of becoming a burden to others. So like we talked about with some of our folks who may have a medical struggle that they know they're going to put their family through that.
I'm surprised you don't have divorce of parents on that list.
Divorce of parents, yep. It's not on there. Loss of a major relationship, I know I didn't go into that, but that's a big one too. We haven't really talked specifically about statistics for kiddos who their parents were divorced, but that wouldn't surprise me if that's a factor, definitely. I'm glad you brought that up. We do know that a child of any age, if they lose a parent to suicide, their risk increases about 4 times to attempt suicide because of that significant loss. So yeah, that's something definitely to be aware of. Thanks for bringing that up. Any other thoughts or comments on the direct verbal, the indirect verbal, the behavioral cues? Yes, ma'am.
What about, like self-harm, you know, you hear cutting or abusing oneself, is that a correlation to self-harm?
You know, thank you for bringing that up. We do hear about that often, and there are a very small percentage of individuals who are suicidal, that, you know, through self-harm, they are trying to attempt suicide, but it's not very much. So what we do know is that folks who are using cutting or some kind of self-harm behavior is more to cope with a mental health struggle. Depression is the main one that we see. And they get that release through a physical harm of some sort. So we will see very often someone who maybe is cutting on their arm that looks similar to like they're trying to cut their wrist open to bleed out. And I am sorry for being graphic, that's what we see. And that's not their intention. You'll ask them, were you trying to kill yourself? No, I was just trying to relieve the pain. Now, could it result in an accidental suicide? Absolutely. So do you want to follow up and get that person some help to work on whatever's going on with them? Absolutely. You wouldn't just, write it off, obviously. There's something more going on. But yeah, we really don't see that there's a huge correlation with that. We do have, we won't talk about this in the slide, but there's a term, intentionally life-threatening behaviors. So all of a sudden, I am really excited about skydiving or extreme sports that might put me at great risk for an accident, if you will. There's a quote that was a celebrity, I'm not going to remember their name, I apologize, that said, "I'm going to kill myself without really killing myself." So there's ways where folks can basically, it's an accident, but their intention was to kill themselves. We don't know though. We can't ask them. So what we can do is if they're exhibiting some of these cues, we ask. That's all we can do. So tips for asking a question. Just want to check and make sure we're doing okay on time here. Before we talk about these, just a show of hands if you're comfortable with it. Who in here confidently can say, yep, I am okay with having a conversation about suicide with anyone at any time? Okay, awesome. I like to see that. A lot of people don't raise their hand when I do this presentation because it can be an uncomfortable topic for lots of different reasons, whether it's you've dealt with it several times in your life, you've dealt with it personally, you've had thoughts. It can be a very uncomfortable topic. I'm hopefully going to give you some helpful hints to make it a little bit more comfortable. It's never going to be, yay, I'm excited to talk about it, hopefully not. But at least when you're presented with an opportunity to talk to someone about it, you'll have some ideas of what you could use. I'm really just going to hone in on number 1 there, because it's usually the one we miss the most. If there is any doubt in your mind, any thought that something might be going on with someone, ask. You are not going to do more harm, you'll be doing more good. Worst case scenario, if you ask someone, are you thinking about killing yourself? They might look at you and be like, what? No? Okay. That's the worst that could really happen. If it's a friend and they're offended by you asking, share with them why you asked. Really, there's no harm in asking. If a person is reluctant, be persistent. I don't mean badger them with the question, but if you ask and they look down at the floor and kind of not really give you a straight answer, ask again. That's telling them that you actually care, you're not giving up, you want to hear what's going on with them. Talk with them in a private setting as much as possible if you can take them away. If we were in a setting like this and I was having a conversation with someone and I think I'm about to ask that question, I might say, hey, you want to come out in the hallway with me, or let's go down to my office and chat real quick. And I don't really need to point out the reasons for that. We all understand that privacy is important, and you would want that same respect in return. Allowing them to talk freely. This is a big one because we so often in our fast-paced lives think that we just gotta, you doing okay? Great. And we don't really care what they said. We keep on about our lives. If you see some of these red flags and you think, you know what, this person needs to talk, make time for that. That meeting can wait for a few minutes. That phone call can wait for a minute. That person needs you at this time. Now, are you gonna launch into a 2-hour-long therapy session? No. We're gonna talk about how to get to the next step. But sometimes they haven't had that opportunity to talk freely about it. Having your resources handy, I'm going to hand these out right now so that you do have these. Everything that we're talking about is in a little booklet form. I would encourage you to keep this at your desk, whether it's at work, at home, wherever you think it would become most handy. It's even got some of our hotline numbers on the back too, and places for you to write additional information down. So I'm just gonna pass these out if you take one. I've got some magnets and some cards I'm gonna set on the back table. Help yourself to those too. More, for sure. Okay, so we're kind of moving into the actual QPR. Please don't hesitate to throw a hand up or something if you have a question or comment as we're going through. Some people do not feel comfortable using terms like suicide, killing, harming. That's okay. You can still ask questions. It's really not that important how you ask it. It's more important that you do ask. So these are just some examples of what might be more of a less direct approach. So have you been unhappy lately? Have you been very unhappy lately? Have you been so very unhappy lately that you've been thinking about ending your life? Do you ever wish you could go to sleep and never wake up? Are you opening the door to give that person an opportunity to say, yeah, I am really struggling? No, maybe I haven't thought about that, but yeah, I'm really in a dark place. Yeah. Now, these are just a few examples. If you think of someone that feel more comfortable for you, jot them down in your booklet. Any others that you maybe have used or something that you would feel comfortable using? There's one up here that is my least favorite. We'll talk about it in a minute. That again, there is no wrong way to ask. Well, I should take that. There's one wrong way. We'll go over that. But really, it's whatever you feel comfortable saying. So a little bit more direct. You know, when people are as upset as you seem to be, they sometimes wish they were dead. I'm wondering if you're feeling that way too. So maybe just kind of trying to relate to them. This is the one that I would not suggest. You look pretty miserable. I wonder if you're thinking about suicide. So when somebody looks at me and says, oh, you look really tired. Thanks. Okay, I should have looked in the mirror before I left for work, I guess. That really doesn't matter. The point is you are pointing out to them that something is a little bit different. Something is concerning you about their behavior. And flat out asking, are you thinking about killing yourself? I have asked that question more times than I care to, and it never once gets any easier. but sometimes I just have to be that direct. Because maybe I've tried some of the less direct approaches and I'm getting kind of a, not sure. I ask, just like that, are you thinking about that? And based on their answer is gonna help you decide where you go next. If you get a clear no, I am not thinking about that, I do not have a plan, okay. If you're still struggling with stuff, let me help you. But if you get a, oh, yeah, I thought about it, or yes, a direct yes, that's very clear then. We need to get you help.
Olivia?
Yes.
I know how to refer to it, as far as an incubation period, when people start thinking about it as opposed to attempting, is there any trend to that? Is it more spontaneous or is it both time periods?
You know, the statistics that we do have on that show that if a person, let's say a person gets some psychiatric hospitalization help, so they go to an inpatient unit for safety observation and to get some medications, maybe get set up with a therapist, it's actually 2 to 3 months after that intervention that we would see folks lead a suicide. So that doesn't really make sense, right? You think, gee, they got help, they were on a good track, and then that happened. So what we know then is it needs to be consistent help. We need to make sure they're continuing to work with their therapist, their psychiatrist, family support, whatever that looks like. So as far as the thoughts when they start to when it happens, all different variations. So just to give you an idea of like how that plays out in what I do, when we talk to somebody that is struggling with some suicidal thoughts and we get them to that next step, whether it's inpatient or we have them come and do some intensive therapy, we do not let that trail off. So that's a follow-up phone call every week if it needs to be, depending on the person. Maybe it's then monthly check-ins, face-to-face or over the phone. I know where I'm at with Continuum. We usually close cases very quickly because it's short term, but folks who we've done suicide assessments on and they were at risk, sometimes 6 to 8 months later, I'm still making a phone call to them just to check in, make sure they're connected. So that's just something to keep in mind. That doesn't fall on your shoulders. I'm just letting you know that that's just kind of how that should play out in working with professional help. The last one on here, I do want to point out the note. If you cannot ask the question, find someone who can. So something that we see in the workplace is I don't feel comfortable asking, but I'm going to walk them down to maybe HR's office, and HR can get them hooked up to Continuum or where they need to go. I know we've got some HR folks in here. You might have already experienced that a few times. I would always encourage you looping HR into that because they have the firsthand knowledge of what kind of resources the company can make available to that person. If you are out in the community and you're talking with just an acquaintance, a family friend, whatever that looks like, again, if you can't ask that, maybe suggest that you take them to a counseling session, maybe go with them. Maybe that means you're driving them to Bryan West Emergency Department for an assessment, whatever that looks like for you. This is the one way I talked about that we don't want to ask the question. You can ask it any other way. You're not suicidal, are you? Why do we want to stay away from that?
So it makes it sound like you're bad or
Yeah.
something's wrong with you. Or,
You better not do that
Yeah,
because
don't
then,
do that.
oh, it's not going to be good, right? So we're shutting the door way before we're even giving that person an opportunity to open up. But it's okay if this is what comes out, and you recognize that's what you said. You know what? I'm sorry. Let me ask that a different way. Or you know what? Just tell me, how are you feeling? Let's talk it out. You're at least on the track of asking. Okay, before we move into persuade, any comments or questions on some of the approaches in asking the question of a person if they're thinking about killing themselves or not? Okay. So the persuasion piece, this one is sometimes maybe 30 seconds. When we talk about having a conversation with someone, I usually give the example that it can be as short as 3 to 5 minutes. When you identify like some concerning behaviors, I'm going to approach them. It can maybe only be 5 minutes before you get up to that next step. The persuasion piece is a simple part of it. Letting them know they're not alone, offering any form of hope to them. I find most often folks feel comfortable relating to them. You know, I have a family member that really struggled with this. We got him some help. Can I do the same for you? It's just a really small portion of it, however, it's still very important. Because if you hear someone say, yes, I'm suicidal, and the next thing out of your mouth is, we better go to the hospital right now. That might scare them, that might say, oh, I don't want to do that, that's not what I was talking to you for, you know, and then they might try to get away from the situation or who knows what. So this is kind of that transition piece to that. Hey, you know what, that's okay, I appreciate you opening up and telling me that. Are you willing to look at some of the options for getting you some help? This just has some other reminders on there. Remembering that it's not the problem, only the solution to a perceived insoluble problem. Do not rush to judgment. I know I mentioned that earlier. When we start judging a situation, we think we know the answer, we think we know what's going on with that person, and we really don't. We don't have all the information. And offering hope in any form. So what does that sound like? You know, what do you have to look forward to in your life? What's going on that's good? I noticed that you've got 3 kids and they're all doing really good in school. That's great. However you relate to that person, if you don't know them very well, ask them, you know, what's going well in your life? Is there any hope for things? The hope and future thinking gives you an idea of where they're at in their risk for suicide. If they are looking forward to things, like, yeah, we have a trip coming up I'm really looking forward to, or I'm gonna graduate from this program soon and I can't wait, I'm looking for jobs already, that at least tells you that they are looking past right now in this moment. So some other ways to help persuade, just asking some of those, will you go with me to get some help? Will you let me help you? So even just opening that up to say, hey, I'm here to help if that's okay with you. I'm not going to force it on you, but I am here to help as a resource. This last one I threw out with hesitation.